Hello friends, today we are going to deal with dialyzer. What is a dialyzer? It's an external device used to work as kidney is called dialyzer. It is being used when the kidney functions fail to function. When purification of the blood is done externally, it is done by using a dialyzer. So what happens if the kidney function fails? The toxic substances accumulate in our body. What are the toxic substances? They are potassium and urea. What happens when the kidney function fails and the toxic substance accumulate? The patients suffer from headache, dry blotches on the skin appear, dizziness, and sometimes it leads to death. And sometimes kidney stones accumulate in the body, occurs, and as a result calcium deposits. As a result, the kidney blocks occurs. So these unwanted toxic substances are to be removed externally when the internal functions fail. That process is known as dialyzer. There are two types of dialyzer, that is peritoneal dialysis and hemodialysis. What do you mean by peritoneal dialysis? This peritoneal dialysis is performed under emergency conditions. That is, when the patient does not require transplantation and when a sudden unfunctioning of the kidney is being seen, then we have to go for peritoneal dialysis. That is, it is a temporary process. Let us see how it is being done. 2 needles are punched through the abdominal walls, that is the peritoneal wall, and this peritoneal cavity is washed with saline water. Since it is being connected to the peritoneal walls, this process is known as peritoneal dialysis. This saline solution, which is being passed through the peritoneal walls, flows through the semi-permeable membrane, which is kept outside the body. Then the toxic substances gets absorbed to the liquid due to the osmosis effect and are thus removed. This is the working of a peritoneal dialysis. Now let us see what happens in a hemodialysis. What do you mean by hemodialysis? It is performed under permanent cases. That is, when the kidney function of a patient has already stopped and external dialysis is a must. In that cases, hemodialysis is being used. It is used for patients who require transplantation. It is considered as a long procedure, that is, that the blood is being purified by the external devices and is being given back to the body. This process is a long procedure which takes up to 4 to 6 hours. Then the process of removing the waste, that is the chemical substances, unwanted chemical substance, that is potassium and urea from the body. Due to the passing blood through the tubes surrounded by the semi-permeable membrane, the blood is being purified. Let us see how it is being done. 2 needles are punched through the artery and the vein, and the patient's blood is passed through or circulated through a coiled plastic tube. This coiled plastic tube is immersed in a solution which has salts of calcium, magnesium, potassium and sodium. Due to the osmosis effect, the toxic substances like urea and creatine are being flowed into the dialytic solution and the blood gets pured. This blood is fed back to the body. Now let's see the block diagram, then it will be explained more. Here we can see that here 2 needles are punched to the artery and the vein of the patient. The blood is taken from the patient and is being passed through a coiled plastic tube which is immersed in a dialysis solution. This dialysis solution, it is being immersed in a dialysis solution. This dialysis solution is having a sterilized solution of mineral. This dialysis solution consists of calcium, magnesium, potassium and sodium. This is being the blood is being passed through the dialysis solution, and at this time the unwanted substance, which is the urea and calcium, is being the urea is being absorbed into the dialysis solution. Once the dialysis solution if the dialysis solution has to be removed, it is being passed through the dialysis recirculating loop to the outlet. Sometimes this dialysis solution will be recirculated after purification, after filtering and heating. It is being fed back to the tank. This dialysis solution will be used for that patient only. This dialysis solution, once used for one patient, cannot be reused for another patient. Once the dialysis solution is being removed and if the device is being used for another patient, then it has to be replaced from the dialysis holder tank. Through it is a holder tank, the dialysis solution is being drained and is pumped and is being fed into the dialysis pit. Here the blood is being passed through the coiled plastic tube and is being purified and is being fed back to the patient. This process is known as hemodialysis. There is a check valve which is being used to check the dialysis overflow and to maintain the minimum amount of solution inside the dialysis pit. Thus we come to the end of this dialysis topic. Thank you.